Alright, hello Mr. Reeve.
How's it going?
I'm doing good. How are you?
I'm doing pretty good today.
Okay. My name is Gunnar. I'm going to be your physical therapist today. As I understand from your income form here, you're just kind of coming in for a wellness visit today.
Yeah.
Okay. What we'll do is, I'll ask you a few questions about kind of what you're doing and how you're doing with your activities. Then we'll go into a little bit of an exam. I'll just kind of check things out, see if there's any deficits anywhere, and what we need to work on. Does that sound good?
Yeah, that sounds good.
Okay. What do you do throughout the day? Do you work? Do you go to school?
Yeah, I'm in school right now, so
Okay.
a lot of sitting throughout the day.
Yeah. So how many hours a day do you think you're like sitting in school?
In school, it ranges from like 6 to 8 hours, and then I gotta study afterwards, so
Okay.
probably add 2 or 3 plus onto that day.
Yeah, so that's a lot of sitting. What about physical activity? What kind of things do you do to get up and get active?
I like to play sports, although I haven't played a lot recently, but I do like to go to the gym and lift a lot.
Okay. So how many times a week would you say you go to the gym?
I'd like to say more, but probably about right now like 5 days a week.
Okay, good. Do you have any issues with going to the gym and any lifts that you do? Do you have any pain in your shoulders?
Yeah, in my shoulders, when I'm kind of doing front raises and side raises. I kind of, after a few repetitions, I start to get a little pinch in the shoulder.
Okay.
But it's nothing, it hasn't really stopped me. Sometimes I'll just have to take a little longer break and then go back to doing them.
Okay. So when you first start doing it, it doesn't hurt, but when you start getting a little bit tired, maybe that's when it hurts.
Yeah.
Okay. All right. And do you only get that pain kind of when you go into that motion, or does it persist after you quit?
No, as soon as I get it out of that position, pain's gone. It's just kind of getting to that upper range that kind of hurts when I'm in the motion.
So that's something we'll look at in our exam. Do you have any other medical conditions that I should be aware of? On your intake form here it says no. I just wanted to ask you.
No, none that.
And are you taking any medications right now?
Nope.
Okay. And then have you had any shoulder injuries in the past?
No shoulder injuries.
Okay. So no, have you had any recent falls or anything? Nothing like that in your shoulder?
Nope, haven't fallen.
Okay. And then I wanted to ask you about how you're sleeping. Are you getting enough sleep at night? Is anything interfering with that?
I think I'm getting pretty good sleep. I could probably do better, but I don't think there's a problem there. So.
Okay. So no pain or anything while you're sleeping?
No, I think I sleep better after I exercise, so I've been trying to exercise a little more. So.
Okay, good. Just one thing I did want to briefly talk about with you sitting 8+ hours a day. Sitting leads to a lot of adverse health benefits, which you probably know.
Yeah.
You hear about it all the time. So I just want to make sure we're getting up and getting active. Whenever you have breaks, try to get up, take a little bit of a walk. You don't have to do anything crazy. Like run or anything, just walk around the neighborhood, just get up and get the blood pumping as much as you can throughout the day.
Okay, that sounds good.
All right, so we're going to go into our exam now and just kind of check your shoulders over and just make sure everything's doing good there. So At this point, I would take his vitals. Since this is a wellness visit and my first visit with him, I'd want to know that. Just for time's sake, I won't do that for the video. Have you had any numbness or tingling sensations anywhere in your body?
No.
Okay. And then, have you had any bowel or bladder changes recently?
Nope.
Okay. All right. So first, I'm gonna do. Let me move this out of the way. So first, I'm gonna do just a little bit of quick sensation and strength testing. Is that okay?
Yeah.
And so for this exam, it would be better if I could see kind of how your shoulders are moving. So would it be okay if you took your shirt off for the exam? Okay. All right, so first I'm gonna just give you a little tap on both sides, and I want you to tell me if it feels the same or different on each side. Okay.
Okay.
So,
Same. Same.
and then could you put your hands out on your lap for me? Good.
Same. 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 Same.
Okay, good. We're looking normal there. Next, I'm gonna just do some quick strength screening, and then we'll get a little more in depth as we go. Okay.
Okay.
So, can I have you shrug your shoulders up, and don't let me push them down. Okay. Hands like this. Good. Don't let me move you out of here. Good. Wrists up. Now hold your arms like this. Don't let me push them up. And then fingers like a claw. Let me move them. And fingers spread out. Okay. Those are all looking good. So next I'll check a few reflexes. So you've probably seen one of these hammers before. I'm just going to give you a little bit of tap on some tendons, and all you need to do is just relax, okay?
Okay.
Here. So could I have you look that way? Count back from 20 by 4s.
20, 16, 12, 8.
Then same thing here. I'm just going to give you a little tap. And then count backwards from 20 again.
20, 16, 12.
Okay. And here, just stay looking away. Okay. Same thing on the other side. And look that way for me. Just relax that arm. Here. Okay. Good. So those are equal on both sides, so that's what we're looking for. So we're doing good there. Next, I want to just go into a little bit of a movement screen. So can I have you look up to the ceiling as much as you can, and then back down to your chest. Good. And then side bend the other way. Any pain with any of those?
No, just a little tightness.
Okay, feels tight. Yeah. Okay. And then rotate, and the other way. Okay, good. Now can I have you lift your arms up above your head? Okay, and then back down, and then out to the side. Okay. Good. So now what I'm going to do is I'm just going to kind of watch how your shoulder blades are moving when we do this. So is it okay if I kind of feel the back of your shoulder blades?
Yeah.
Okay. So I'm just going to feel those really quick. Alright, now I want you to lift those arms straight up above your head. Okay, good. And then out to the side. Good, back down. And then let's try this standing. Yeah, better. Good. And then to the side. Good. Alright. That's looking okay, I think. So next I'm going to observe your posture. So just kind of sit how you normally would, like just if you're in class.
Okay.
Okay. So notice we got a little bit of rounding there, not too bad, a little bit of forward head, but nothing too crazy. I noticed that when he goes up into flexion, his head really juts forward and it looks like he's missing a little bit of mobility. So we'll go into that as we go. Before we move on, I just want to take a quick measurement just to kind of get a baseline of where we are with raising up. So can I just have you raise just your right side up as far as you can? We've got about 162 there, and on this side. Yeah, about the same, 163. So it's pretty equal both sides, but maybe missing a little bit of motion up into that area. So next I'm going to just check some joint mobility. So can I have you scoot just this way a little bit? Okay, so I'm just going to feel for a place here. I'm going to give a little pull on your arm, okay?
Okay.
So not seeing too much motion with the sulcus sign. And with a load and shift, he might be a little bit limited, but not too bad. And I would have him scoot over and do the same thing on the other side. But he might have a little bit of loss of mobility, especially posterior. It feels a little tight. But fairly normal, I think. So while we're up sitting, I just want to do a few tests. So can I have you turn your thumb to the ground like this? And I'm just going to bring you all the way up. You get any pain with that?
No.
Okay. And then same thing on this side. Turn the thumb down and then bring that all the way up.
No.
No pain with those?
No.
Okay, put your arm straight out in front of you like this. Let me grab it and I'm just gonna. Any pain there?
No.
This side. Okay. And then I just want you to bring your arm all the way across. Any pain with that motion?
No.
Okay. So we've got our negative near, a Hawkins Kennedy, and a crossover. So he doesn't have any of those positive impingement tests. Next I'm going to do just a little bit of strength testing. So I want you to put your arm right out in this position and hold it there. Don't let me push you back, okay?
Okay.
Hold, hold, hold. Good. And then don't let me push you forward. Hold, hold. Good. Okay, so he's just a little bit weaker in external rotation, but I would still give him a 5 out of 5. He's pretty strong in that area. Let's check this side. Good, so don't let me push you back. Hold, hold. And then don't let me push you forward. Hold. Okay. Same thing on that side, just slightly weaker into external rotation, but still really strong in those motions. Next we're going to do a little more in-depth strength testing. So can I have you put your arm straight out in front of you like this? And don't let me push you down. You can use your other hand on the table if you need. Hold that. Hold, hold, hold. Good. Side. Hold, hold. Good. So with that one, I was assessing kind of a scapular motion as well. He's having a little bit of downward rotation of his scapula with that test, so that might suggest maybe a 4 out of 5 on the serratus. Next, I want to go into. Let's have you lay down on your back here. And so I'm just going to take your arm, have you scoot this way just a little bit. And I just kind of want to see how it's moving out here. So we got pretty close to 90 into external. And then pretty close to that in internal as well. You can see his shoulder starts to kind of pop up right there. Pretty good. I would do that on the other side, but for time I'll kind of skip that so you can skip back over. And then come back over one more time. Sorry.
No, you're good.
So, and then I'll kind of assess if he has any apprehension in this position. Is that uncomfortable at all?
No.
Okay. Good. Then I'm going to do just a little bit of joint mobility, so just relax your arm here. I'm just going to take it. Okay, so you can scoot back on the table. So it feels like he has pretty decent mobility in there. It doesn't feel too excessive, and it also doesn't feel super restricted either. Let's have you lay on your stomach now. Okay. I'm going to do a little bit more muscle testing, so scoot this way so your arm is hanging off. Good. So what I want you to do is I want you to think of bringing this shoulder blade up and back towards your spine like that, good, and your arm out this way. And I just want you to hold that there, okay? Don't let that scapula move. Hold, hold, hold. Good. So he had some movement there in his scapula, so I'd give him a 4 out of 5 on his middle trap. Then I'm going to have you come up like a Y. Good, so arm like that. Come up like a Y. Squeeze that scapula down and back. Don't let that move, okay? Hold, hold, hold. Good, and I would say probably maybe a 4- on that lower trap. And let's test the other side. So arm up like this. Squeeze that scapula in. Don't let it move. Hold, hold, hold. Good. Same on that side. And then up like a Y. Down and in. Don't let it move there. Hold, hold. Yeah, so he's about 4 on both of those motions. Okay, and then last thing I wanted to do is just check some mobility, so scoot this way a little bit. And I'm just going to give you a little bit of pressure on your spine here, okay?
Okay.
So it does feel like we have a little bit of tightness there. So I would do some mobilizations here probably, and I would kind of assess his feelings about manipulation. So have you ever had like a quick stretch on your back where it kind of popped up here?
Yeah.
Okay. Did you like that? Did you
Yeah, it
feel
feels
like
good.
that helped you?
Feels really good and helps usually.
Alright. Well, I'll probably do that. So I'll take up a little bit of slack and just give you a quick stretch in this position. Is that okay?
Yeah.
Okay. So start there. So take a deep breath in and all the way up. Okay. And one more. Breath in and all the way up. Okay, good. We'll kind of assess that motion again. Okay. And so I think that thoracic manip is going to help him open up a little bit as well. When he goes up into flexion, his head kind of scoots forward, so that's going to help open that up. And then I'll have you lay on your side. Let's go facing that way, actually. And then scoot to me. And then put your hand kind of, just kind of rest it there. So I'm just kind of going to assess his mobility of his scapula, see how it's moving. Okay, and I'll kind of do a little bit of palpation while I'm here too. So can you point to where you get that pain after you do a lot of shoulder raises?
actually on the other side.
Let's have you sit back up.
Sit back up?
Yeah. Alright, so where's that pain?
I mean, it's kind of hard to tell because I'm not feeling it right now, but just somewhere in right there.
So how much do you usually have when you do those shoulder raises?
Usually like 10-pound weight.
Okay.
And that usually happens like near like rep 8 or 10.
Okay. So kind of in this area here.
Yeah.
Alright. But you're not having any pain with those right now. I'm not
No.
touching them. So I think what could be happening, we've seen you have a little bit of weakness in your scapular muscles back there. So one thing that could be happening is when you're doing those shoulder raises and you're getting really tired and those, your scapula moves with your arm when your arm moves up. It's not all your shoulder joint, it's your scapula as well, your shoulder blade moving up and down. So when some of those shoulder muscles get a little bit tired, they might not work as well. So when you're moving, your scapula isn't moving up enough, and you might be, hitting on some of those bones in there when you're doing that.
Okay.
And that could be causing that pain.
Okay.
So what we're going to do today is work on a little bit of mobility exercises. I noticed that you have a little bit of decreased mobility in that thoracic spine, and then we're also going to do some strengthening for those muscles to see if we can get those a little stronger so they don't fatigue as easy.
Okay.
Sound okay?
That sounds good.
Okay. So first what I want to do is start with a little bit of strengthening. So we have our makeshift exercise ball here. Very nice. So I call these Y's and T's. So we're going to do that same kind of motion that I did when I kind of tested your strength, but we're going to do it on our exercise ball here, so it's a little bit unstable and you have a little bit more motion to go down and up. Okay?
Okay.
So lay with your chest on this exercise ball. Alright, and I'll give you our nice, probably start with a 2 or 3 pound weight. So what I want you to do is that same motion, I want you to make like you're doing the YMCA. So make like a Y, good. And when you do this, I want you to focus on squeezing those shoulder blades down and back into your back pockets, okay? Good, so squeeze here, here, hold it for about a second, good, and then relax. And then do that again, good, squeeze here, nice. So try that about 10 times. Okay, so we'll say that's 10. So how did that feel? Did that feel hard, easy?
It felt, pretty decently hard doing the holds.
Okay, so you felt like it was kind of getting you tired back here?
Yeah.
Okay, so let's take a rest. We'll do that one more set of 10 and see how you feel with that. We'd assess how tired he is. If he's feeling really tired and fatigued, like he's getting a little burn back there, we'll leave it at 2 sets of 10 with that 2 to 3 pound weight. And then another one here I want you to do is T's. So we just made a Y with our arms. Now we're going to go straight back and make a T. And same thing, this isn't really for our arms, this is more for our shoulder blades. So I want you to squeeze those shoulder blades straight in, pinch them together. Good, hold it for about a second and then let down. Good, do that again. Nice. And then try 10 of those. I'd probably start him out with 2 sets of 10 on these as well if he feels like that's moderately hard. We could increase or decrease the weight and also increase the reps. So the next one I want to show you is a little bit for just some mobility. So I'll have you laying on your side.
Which side?
Yeah, that side. because this is the shoulder we really want to target with this one. So what I want you to do, these are called shoulder circles. You need a pillow?
Yeah, that'd be awesome.
So what I want you to do is I want you to take this arm, put it straight out in front of you, and then we're going to go up all the way, and then let's start at the bottom actually. We're going to go up all the way, as far behind you as you can. Good. And so come back. So,
or come back this way?
Yeah, come back that way. Good. So now with this one, I want you to stay a little bit straighter. And I want to see if you can keep your hand kind of close down to the mat when we do this. So kind of keep it, trying to touch the mat as far as you can. Good. And then if you need to, we can lean back just a little. Good. Okay. Yeah, and then stay there and then go back. Just like that. Good. So you notice when you get up into this area, you can't really get, your arm is low about right there, right?
Yeah.
Good. So I want to kind of work into that area. Try that about 10 times, just nice and slow and controlled up there. And so what this is going to do is stretch those shoulder muscles as well as that pec muscle and allow you to kind of open up that shoulder when you're doing your shoulder exercises or other activities. Good. So we'll try it about 10 times on that side and 10 times on the other side. We'll keep it simple. Good. And then last thing I wanted to do, I'll have you sit back up, is we'll come over to this wall here. So using the wall is a really good cue for your shoulder blades when you're going up into this motion. So this is also going to kind of open that chest up, open those shoulders up so you can get a little bit higher. I want you to put your elbows on the wall, focusing on squeezing those shoulder blades down and back. I want you to keep your elbows on the wall as you go all the way up and all the way down, keeping that shoulder blade squeezed. Good. Nice job. Good. How's that feeling?
Good. I feel like I don't have a lot of control back there like I kind of thought I did.
Yeah. Yeah, you kind of think you're pretty strong until you start doing some of these and you realize maybe you don't have as much control as you think you do. Nice. Squeeze down and back. Good, good, good. Alright. So I'd have him do that about 3 sets of 10, unless he's getting super fatigued, then we back off a little bit. And then, so I'll have you sit back down here. So since we worked on a little bit of mobility today, we did a little bit of mobilization there. I want to kind of reassess how your shoulder's doing with your range of motion. So kind of using those principles we've been working on, reach those arms up overhead. We got about 165 there, so maybe just a little bit more motion. Let's try this side. You can just do one arm. Okay. Yeah, about 167 on that side. So for time's sake, we kind of skipped some of the mobs and some of the sets of the intervention, so hopefully we'd see a little bit more improvement. So as you go home, I want to see you back in about 2 weeks. So since you're not having any real pain or any problems with what you're doing, I want you to work on these things at home. I'll give you a printout sheet of all the exercises and how many times to do them. I want you to work on these. I want you to do them all once a day at home, and then come back and see me in about 2 weeks and we'll see how you're doing with it. We'll do a little bit more of that manual therapy, and then if you feel like we need a little bit more work, we can see maybe a month after that. So this is going to be something that you're working on by yourself, and I'm just going to kind of check in with you as you go, okay?
Okay.
Does that sound all right?
Yeah, that sounds good.
Any other questions you have for me as we go forward?
No, I think that sounds good. So just kind of working those exercises and
Yeah, and so
keep going to the gym and.
Yep, yeah, keep going to the gym, keep staying active, and we're gonna do those strengthening, the Y's, the T's, the shoulder circles, and you can do those more than once a day if you feel like they help you, if they feel good, and you should start seeing improvement in the amount of range where you can keep your hand close to the table.
Okay.
And then those wall slides, do those once a day as well, and I'll give you that printout sheet.
Okay.
Okay, sounds good.
Okay, thank you.